Very good morning, everyone. So first of all, I would like to thank the organizers for giving me this wonderful opportunity to talk about our work today in this meeting. And today I'm going to be talking about snakebite treatment costs, which is a very popular topic whenever we talk about snake bites, because that's what is leading to economic burden. But not much research has been done in this area because of the complexity associated with this. So I'm going to be specifically talking about the snakebite treatment cost in private healthcare settings, particularly in Tamil Nadu, which is in South India. As many of you know, so we launched a mega size public awareness campaign for snake bites in 2018, and this is specifically in Tamil Nadu. So through this activity, we are improving snakebite public awareness through multifaceted activities. And during this program, we are also identifying and identified various issues, and we are trying to tackle all these issues in order to save lives from snake bites with the support of a multidisciplinary or multi action group. So we got a massive network of people, including doctors, including government officials, NGOs, media, all those people, snake rescuers, all those people, and we are trying to tackle the issues as efficiently as possible and wherever we can. So why do we have to analyze the treatment cost? As I said, this is a big topic and this is a big problem because this is what is leading to socioeconomic impacts in the communities. So the government is providing free treatment for snake bites in all the government settings. And the government has got primary health centers, which is available for around every 20 kilometers surroundings, except in tribal areas. And then they do have a taluk headquarters hospitals. Then they do have a district headquarters hospitals and medical college hospitals. And they also have a super specialty hospitals. So we encourage people to go to hospital as quickly as possible to seek treatment. Then the question from people is, who is going to pay for the treatment? Then we are asking them, government is providing free treatment. Why don't you go to government hospitals? They got a list of reasons to explain why they don't want to go to government hospitals and why they want to go to only private hospitals. Even for a single, like a simple fever or common cold, people try to go to private hospitals. So there are various reasons. I don't want to get in there. So these people, because they are going only to private hospitals and the private hospitals are charging the amount of money, whatever they want to charge, because there's no proper regulation here. And if some hospitals are treating snake bites with 100 pounds or 200 pounds, while other hospitals are treating up to even 30,000 pounds, 40,000 pounds. So how can we really estimate a cost here? What is the average cost? We can say that every single bite is different and based on the complications, the cost will vary, but at least we need to start somewhere. So because of all these complications and all the cost that they are being charged, it's leading to socioeconomic impact. And most importantly, most people in rural areas don't have any health insurance. And that's the biggest problem because they cannot be covered for their treatment through any health insurance. So we wanted to calculate an average cost in private tertiary healthcare settings to identify exactly how much it's costing, at least an approximate range we need to know to initiate our discussions with the government and insurance companies. So that's why we wanted to start to collect this data. So when we wanted to collect the data, then we realized that it's extremely impossible to collect the data because most of the hospitals didn't want to reveal how much they are charging their patients for obvious reasons. They thought we will reveal their name, so it will cause reputational damage. They might be seen as very expensive hospitals in the community. So lots of problems. So many hospitals didn't want to give the data. And some hospitals, we realized they don't even give proper receipts. They'll just handwrite something and give it to people and get us a cash. So it's really difficult, but eventually we managed to get data from 10 hospitals on a condition that we should never, ever reveal their names. Anyway, we got the data. So over 3 years, we managed to get treatment cost data from 913 patients. All the personal details were anonymized, but we got some background details in order to understand this data. Then we divided this data based on the type of snakes, particularly the big four snakes. That's Russell's viper, kite, saw-scaled viper, cobra. And there were some non-venomous cases, and there were some cases where the doctors couldn't ascertain what snake it was. So that's classified as unknown category. So out of these 913, as usual, Russell's viper is our hero. So that's the one is causing predominant bites. So you can see it's 355 bites in here, and nearly half of the unknown bites will be Russell Viper. Then the next one was Crite. We had like 133 cases. Saw-scaled viper, we had 108 cases. And saw-scaled viper is not a really big problem and it rarely kill people. And the complications rising from this snake is not really huge. And the doctors in India think that it shouldn't be in Big Four at all. But anyway, that's a separate topic. For cobra, unusually, we had only 69 cases. This is a major concern in Tamil Nadu at the moment because we are not seeing many cobra bites at all. And people started thinking that the cobra is becoming probably extinct. We don't know that. So we need to really save cobras there. And for non-venomous snakes, we had like 87 cases. And as I said, in unknown category, we had 161 cases. So what is the actual treatment cost in these 10 hospitals? So it's a hugely variable, as you can see in the total cost here in this ball. And the Russell's Viper is costing quite a lot of money. And then the next one is a Crite. Then we calculated the average and the minimum and the maximum cost for all of these, because that's what we were interested in this study. So for Russell's Viper, on average, it's costing around 110,000 rupees. That's around 1,000 pounds. And the Crite, it's costing around 47,000 rupees, around 470 pounds. And saw-scaled viper, around 28,000 rupees. That's 280 pounds. For cobra, around 86,000 rupees. That's around 860 pounds. For an unknown, it's around 77,000 rupees. Again, 770 pounds. For non-venomous, not really expensive, but it's costing around 170 pounds. So if you look at the minimum cost for Russell's Viper, it's around 2,500 rupees. That's 25 pounds. Yeah, because not all the bites are going to be venomous, and some of them are dry bites. And in maximum, it's costing up to around 694,000 rupees. That's around 6,000 or 7,000 pounds. Same thing for Crite. The minimum is around 105,000, sorry, 10,500 rupees. That's around 100 pounds. And then the maximum, it's in one case, it went up to around 820,000 rupees. That's 8,000 pounds. Saw-scaled viper, as I said, it's not really expensive. It's around 5,800 to start with, and it's going up to around 1,500 pounds, something like that. And then the cobra, similar cases. So the bottom line is, on average, most of the snake bites can be treated with 1,000 pounds. That's a key point, key message from this one. Then out of this total cost, we've broken down this cost into 4 categories to see exactly where the money is going, why this is really expensive. So we've broken down into hospital cost. That includes intensive care units or critical care units, and then the wards and surgery, all those things. And then the investigation, how much the fees is actually going to the specialist or clinicians. Then we also divided into the lab bills or scan reports, those things, because most of the hospitals do have their own labs or scans, but some hospitals send it to other people. So we wanted to see how much it's costing there. Then finally, we wanted to find out how much the actual medicines are costing, because it's a pharmacy, that's a separate bill. So when we look at the hospital bill, that's the biggest expense, because based on people, how many days they are staying in intensive care units or critical care units, the cost is varying quite a lot. And then some people stay in hospitals for 30 days. Some people are staying there only for 2 days. So it's varying in cost. And some people need surgeries. So based on that, it's varying quite a lot. So that's the most important cost out of the treatment cost for snake bites. But if you look at the investigation, that's not really expensive. It's costing in most cases only around 10% of the overall cost for the specialist fee or clinician's fee. And if you look at the lab and the scans, these type of things, that's not, again, isn't very expensive. It's only around a 10 to 20% a fraction of the total cost. And then the next important cost is the pharmacy bill. That's the medicines. So we thought the antivenom will be costing quite a lot of money, but that's not the case actually. Yesterday, even David mentioned the antivenom cost. It's only around 5 pounds per vial in India, and they will get 100 milligram of antibodies there. And according to the protocol, they need to give maximum of 30 vials, but in some cases here, they're given up to 60 vials because the doctors will decide how many vials they need to give. So that's not a really very expensive one, but associated medicines, all the painkillers, antibiotics, surgical consumables, or other consumables that are being used in the hospital is costing the huge amount of money. So the hospital cost is the first important one. The second important one is the medicines. Then the investigation and the lab, these things are just a fractions. Then we wanted to see if there's any difference between the males and the females in terms of the total treatment cost. So here we are talking about only total cost. Then again, we analyzed this based on the big four and unknown and non-venomous category, and there's no significant difference between males and the females. They are being equally charged pretty much for their treatment when it comes to snake bite. Then we wanted to compare for age categories. Yeah, based on the age category, is there any difference in the treatment cost? So we broken down everything into like a 10 years gap of age, 0 to 10, 11 to 20, something like that, all the way up to 100. Then we analyzed this data as well, and clearly there's no difference here based on the age. It doesn't matter whether you're a child or a 70-year-old kid or snake bite, based on the complication, there will be a treatment cost, and there's no huge difference between the here. Then the next one, as I said before, antivenom. So based on the number of vials of antivenoms being used for each person, is the cost is changing. So we took the number of vials each person received and then compared to the cost. So as I said, in some cases, people were treated with just 0 to 5 vials. In some cases, they went up to 60 vials of antivenom. But antivenom is not that expensive compared to all the other costs we are talking here. Even if they give 60 venoms, it's only going to be 300 pounds. So we didn't see any massive differences here. So this suggests that the antivenom is an essential component, but that's not the critical component to augment the treatment cost. So that's what we are finding out here. Then finally, we analyzed the length of stay. And this is where we found out that the length of stay is a critical part in exacerbating the treatment cost. So if somebody is staying there only for 1 or 2 days, the treatment cost will be far too minimal. And if the people are staying there for 2 weeks or longer, the treatment cost is going to be ridiculously expensive. So that's what we identified here. So in summary, we identified that the Russell's viper is the predominant killer or predominant culprit to cause most of the incidents still. And mostly the males are largely affected because that's common. And in every study, we are finding out that. And the age group, if you look at it, so mostly the working age group between 20 to 60 are the most important people getting affected because of their occupation and outside work most of the time. And the number of vials of antivenoms, they are starting from 0 and going all the way up to 60 vials in these hospitals at least. And that's not the biggest determinant for the treatment cost. And then the length of stay for the hospitals varying hugely from 0 to 30 days in most cases. And that's what the biggest determinant when it comes to treatment cost. And the treatment cost varied here hugely from 0 to 850 or 8,500 pounds. But on average, most of the treatments can be given with around 1,000 pounds. At least 70 to 80% of the cases can be treated with 1,000 pounds. Okay, so what is next we can do with this? So we started lobbying with the most important health insurance provider in India. That's called the Star Health Insurance. And luckily, they had a fantastic scheme called Accident Trauma Care Policy. But they never promoted this scheme because they don't make much profit out of this scheme, so they don't promote. And this scheme cost only £5 as annual premium. So with this £5, anyone can climb up to £1,000 worth of treatment in any private healthcare hospitals for accident and trauma. So they never included snake bites in this, or even if they included, they didn't explicitly say that. So we started lobbying with the CEO of this company, and then finally we had a meeting with them, and they confirmed snake bite in this category officially. And he came with me for a press meet as well, and officially launched. And even though they are not going to make a huge amount of profit out of this scheme, they are happy to cover snake bite for the societal cost. So now we are promoting this scheme. It's called Accident Trauma Care. It's all over India. not just to Tamil Nadu. Anybody can take this scheme with just £5 annual premium. And if they are bitten by a snake, straight away they can climb up to 1 lakh rupees. So now, based on this data, we are initiating our discussions with the Tamil Nadu government and the central government as well. So Tamil Nadu government has introduced a Chief Minister Comprehensive Insurance Scheme around 10 years ago. That's covering snake bite, but it will cover only up to £300. They will not give anything more than that. And this scheme is not available for all the people. So people who's got a family annual income of only £700 per year can get it. But after lobbying, the government now increased that cap to £1,200 last year. So those people can also get this scheme, but still the treatment cost will be only up to £300. Now we are asking the government to raise that up to £1,000. The problem is, if they raise up to £1,000, all the private hospitals by default will climb £1,000. That's the biggest problem we are facing at the moment. So until we regulate all of this, it will be really difficult. Similarly, the central government of India released Prime Minister Health Insurance Scheme. So that's also covering snake bite, but it's in a very smaller amount. So we are also discussing with the central government to see whether they can improve this. And we are also convincing lots of rich people to sponsor insurance for poor people. At the moment, we are giving insurance for all the snake rescuers because they are dying quite often while they are catching snakes. So there are lots of things we can do, but at least we got this data that can confidently talk to people to convince them to do something about the treatment cost. So with this, I would like to thank lots of people who are involved in this mega size project, not just this treatment cost. So as I said, lots of clinicians, lots of journalists, media, government, and non-governmental organizations involved in here. Particularly for this one, I would like to thank the Toxivent team because they collected all this data from 10 hospitals. And in my lab, I'd like to thank all the group members, particularly Anika, Tate, Samir, and my colleague Fazil for analyzing all these data. So we are still analyzing these data. We are trying to answer as many questions as possible from this data, but still, I wouldn't say it's a perfect data. And I wouldn't say this is going to answer all the questions around snakebite treatment, but I would like to thank your attention, and I'm happy to answer any questions that you have. Thank you.
Thank you very much for this very comprehensive presentation. Any comments? Yes, there comments from the audience?
Thanks. Beth here. Huge congratulations on getting the insurance stuff sorted. That's great. I just wanted to go back to your earlier slide. If the government hospitals are providing free care, I wonder if you could elaborate on what the reasons are, the key reasons that people don't attend, and do you see these as issues that can be addressed? And if yes, then how?
Okay, I think it's better to talk outside. I don't want to talk on record in detail.
Okay.
But we can address all these things, but it will take ages to address because it's not easy. So that's the simple answer for this question.
Okay, I'll catch you later.
A much easier question, I hope. In your data set, is there a correlation between the length of stay in hospital and the number of vials of treatment that were needed? And the obvious reason I'm asking is, if antivenoms could be improved to reduce the number of vials needed, is there an indirect benefit because it reduces hospital stays?
Yeah, so length of stay definitely is correlated with the treatment cost. But the antivenoms, mostly they are giving only in the initial few days. They don't give antivenom every single day if you're staying in the hospital for 30 days. So maximum they will finish the antivenom doses within 3 days, as far as I know. It will never go beyond 1 week. So that's not going to change. And in India, even if you produce a fantastic antibody, if the cost, as David explained yesterday, if the cost is not cheap, it's not going to change anything. And particularly in Tamil Nadu, that's where they're collecting the venom for antivenom production. The antivenom is fantastic. We don't have any issues with the antivenom in Tamil Nadu at all, as far as I know, in my 18 years of experience. So the only thing we can improve, we really want a monovalent antivenom, particularly for Russell's viper, because that's what is causing nearly 50 to 70% of the bites. We desperately need a monovalent for that. So that's what we are discussing at the moment. But the new antivenoms, recombinant, all those things, I don't know how this is going to change if the cost is going to be expensive. I hope it answers the question.
Yes, Juan.
Even if you want not to comment in public here, but is there any big difference between the outcome in the private, in the governmental system? So in other words, if you were bitten, you would care to be in one system treated or in the other?
There's a huge difference in the outcome. Definitely. We
Okay.
can discuss this in detail.
Sure.
There's definitely a huge difference. Yeah.
Yeah, I think we need a presentation on the health system in India and differences between private and public sector. It goes way beyond snake bite.
Yeah, off the record,
It's a major issue in India.
Off the record, I can explain everything, but because I'm working with the government, I can't talk too much about the government.
Ian Cameron, is Tamil Nadu typical of the other Indian states, or is Tamil Nadu an exception?
No, it's a typical state compared to other states, and it's getting largest number of the snake bites as well. And the population is around 72 million, and more than half of the population living in rural areas. And still in some villages, particularly in tribal regions, there's no road facility, there's no ambulance facility. So people still carrying patients to hospitals and they have to walk several hours. So it's typical compared to other states.
Marike Dijkman from the Netherlands. I was wondering, these cost older people, they were survivors or they were also people that are deceased?
So all these data, I think out of this data, there were only 2 patients died because mostly in private hospitals, they claim that they treat 100% snake bite victims because during the admittance, if the patient is very, very seriously ill, they will not admit into the hospital. So that's what we've seen. So they claim 100% survival rate. So in our data set, I think only 2 people died. We didn't look into it, but I look into it. Definitely not more than 2.
Maybe one question for me as well. Did you see any difference between hospitals with regards to costs? Some hospitals, without disclosing any name, of course, some hospitals charging much higher prices than others?
No, between these 10 hospitals, we didn't see any difference. But there are some hospitals, even last 2 weeks ago, when I was in India, I received a complaint or a statement, whatever it is. There's one hospital trying to charge 45,000 pounds for a 13-year-old kid to treat snake bites. So the family already paid 25,000 pounds. The doctor is demanding another 18,000 pounds. They didn't have money. So they're trying to raise funds to change this. So within these 10 hospitals, we didn't see any difference. That's why we didn't separate this out.
Okay, thank you. I'm asking the people online if anybody would like to ask a question or make a comment. No?